Sometimes in sex, you want to show up differently, but you aren't able to get there. Maybe you want to be more comfortable with your body and being naked, or maybe you want to stop stressing about your performance all the time and actually enjoy what's unfolding in front of you. Sometimes in relationships, you hit a wall. Things aren't going any deeper, and no matter what you try, nothing seems to work. It's like knowing that it's possible to change, but not having the answer in front of you. Well, in this episode, we are going to explore one way to create that change to get that answer that you need. Welcome back to The Naked Connection. This is the show that supports driven men to reach sexual mastery and build deeper connections. It's Kirsten, your soon-to-be licensed therapist, and in this episode, we are exploring psychedelics and sex. To have this conversation, Dr. Stephen Radowitz is here. Dr. Stephen has practiced internal medicine for over 20 years and has come to see the power of psychedelics for treating things like PTSD, mood disorders, and really just improving mental health and well-being overall. And yes, that includes relationships and sex. And I want to share a small disclaimer. I understand that this topic might not be for everyone. However, there are actually ways to benefit from this conversation without taking any psychedelics ever. So perhaps consider tuning in or maybe listening to challenge yourself in a space that you wouldn't normally hang out. All right, you guys, let's get some. Dr. Stephen Radowitz, welcome to The Naked Connection. We're really excited to have you here with us today.
Thank you for having me.
Yeah.
Appreciate it.
I'm just thinking as we get into this conversation, knowing that there are so many different types of substances that could be classified as psychedelic, if you could maybe share like a little bit of a breakdown of perhaps ketamine, since that is the one that is, I suppose, legally usable that you administer in your facility now, just so people kind of have an understanding of what that is and looks like.
Yeah, I think ketamine is, it's a very safe drug. It was developed as an anesthetic agent to help people, put people under for surgery. And over the years, they found that it was actually having incredible effects on people's mood, like people with mood disorders, and their mood disorders were improving. Chronic people with chronic pain also had incredible effects. And addiction, it was used and there's a lot of studies for its use in addiction, and we use a lot in our center here. We have incredible results for people with alcohol use disorder and so various different marijuana overuse, things like that. So ketamine itself is a psychedelic. Anyone that doesn't, it really depends on the dose used. People who use it recreationally in lower doses tends to be a little bit more euphoric. But as you escalate the dose and you use it in a proper setting with an eye mask and music and specific music, it does bring you into a very psychedelic experience. That's very safe when used in a clinical setting. The other agents, some people have heard, I'm sure, of ayahuasca, LSD, psilocybin or mushrooms, also psychedelics. And there's some overlap between all of these and some of the neurotransmitters, but they all have they're almost like different chemical keys to the ego. And they help almost diminish the effects or diminish the influence of the ego, and allows our consciousness and the way we think to come from a much more open place. So the way we process things, the way we process our past, the way we see the world, when you're under the influence of these substances, these psychedelics, and the word psychedelic comes from the word soul. It comes from the Latin word, soul manifesting. So it's seeing the world, what they call from the soul, more soulful or more open view of things. So that's where the whole idea of psychedelics. So psychedelics not crazy. And you can also have a psychedelic experience by just doing, certain types of breath work, doing a really good yoga, having an amazing run. During a marathon, people have psychedelic experience where you're really dissociate from the sense of self, and you sort of go into this flow state of just being really super present. People go to, these meditation retreats and they don't talk for a week. People have psychedelic experience that way, studying spirituality. Some people through different spiritual, just study could have psychedelic experience, and just allows you to see the world from a different perspective, not from the limited perspective of the mind, of the ego, of all the trauma and things that we've carried over throughout our life, but seeing things from a much more open, more wisdom, more wise, or more deeper wisdom, more intuitive part of ourselves. So
Yeah. That's a really beautiful, I've never heard the Latin terminology described that way. And so to think about it from that perspective is really powerful. And I'm I'm thinking if someone's listening to this and they're wondering, okay, well, this is really cool. What does this have to do with relationships?
right.
What would you say?
I mean, I think first, the most important relationship we have is with ourselves. So if we don't have a good relationship with ourselves and we don't know ourselves and we feel a lack within ourselves, it's going to be hard to really give to others. And often I think people get into the relationship sometimes for the wrong could be for the wrong reasons. If we're getting into a relationship thinking something, I'm missing something, I'm lacking something, I need something from outside to complete me, it's very hard. So you're going into a relationship expecting to receive something rather than to give something. But when we
Mm,
realize that, when we get to a place of wholeness, of really loving ourselves and caring about ourselves and having respect for ourselves and confidence with ourselves, then we just want to share that with someone else. So it's like you're going to a relationship with just wanting to share because I have an endless amount of this of myself to share. I just need to give it to someone. And if you have someone on the other side also in that state of mind saying, hey, I also have a lot of love I want to share, you have these two people just giving to each other, and sometimes one person will give a little more and one a little less. We'll be in different states. We can't be in this perfect state of inner love all the time, of course not. But if we're, the problem with being in a place where we're looking for someone to complete us, the second they pull back, the second they're not giving us what we think we need or what we want,
mm,
then we say, oh, then I feel whole, I don't feel whole again. And we start to be resentful. It starts to affect the relationship. And then the fight, the issues start. And so I think that's the source of a lot of our issues.
yeah.
So I think,
It's really wild how something like a mushroom or another type of medication or medicine can really connect. It's like connecting you to yourself and also removing you from yourself at the exact same time, and the profound impact that can have on the way that you engage with other people. It's like a softening, or there's less of a guard, is how I've come to describe it
exactly.
or experience it.
Yeah, I think it is. I think it's that you realize that all this sort of illusion of separateness, illusion of that I'm not good enough, or I'm not. And we have a lot of things we pick up from children. Someone might have said something to me as a kid, that made me feel not enough, or my comparison to others, feeling insecure about myself. That also. So what these psychedelics do is it sort of puts all that on hold and gets us to appreciate
Mm.
a deeper part of ourselves, a more whole part of ourselves, without all that sort of those errant, sort of ideas, is these sort of associations we make within our brain. And
Yeah.
yeah, I think I think, and that brings us to a much more open place, and that we can give to others, when
Yeah.
we feel
Yeah,
safe.
and I was gonna ask, I don't know if you do if the treatment is solo or if you do this with couples or how that could possibly look.
Yeah, I mean, I find it such a personal, like psychedelics are such a personal experience. I've done my own personal journey work, sometimes in a group, but usually the experience itself should be in yourself. It should be an inner in a journey within yourself. So often I like to do it where we do it here is we administer the ketamine um alone in a room with an eye mask, earphones, and you go into an inner experience. So even if you're in a journey like more of an, people do journeys, ayahuasca and places where, but really you should stay on your own, stay to yourself, stay on your mat, and you really go into that journey within yourself. So you can be around your loved one, but you shouldn't be, I don't personally, and people will disagree with me, but I don't think you should be interacting while under the influence of it. And then afterwards, it's that openness you feel afterwards that's really you gain benefits. So I don't think you have to be in the room with, and sometimes it could be actually harmful. Sometimes if there are problems within the relationship, people don't feel comfortable really letting go into the experience
Mm-hmm.
themselves because they don't feel adequate, maybe because of things that are said, or there can be some problems. So I think I really believe that, I think it can be an unbelievable experience for couples, but it should be a sort of two separate experiences, getting to love yourself, and then you come back together and you could integrate together for sure
Yeah.
afterwards. But
Yeah.
under the influence, I think it's best to be separate. Yeah.
Okay, that's really good advice. Yeah, it's because it is such an internal experience and then stepping out and being able to perhaps integrate with your partner.
Right. There
Yeah.
are exceptions. There are, people use MDMA when there's a lot of traumatic. So MDMA is actually not technically a psychedelic.
Mhm.
MDMA is what we call ecstasy or molly. It's a substance. It's more of an empathogen. So it brings up a very intense sense of love. You can have, with an eye mask, if you do it very inward experience with an eye mask and earphones, you might have visions and things like that. But generally, that can be used in couples in a sort of couple therapy situation
Mhm.
where people actually they do, and both people are in a very empathetic state where they can talk out some of their issues and
Mhm.
some of the places where they've been stuck and find that love for each other. So in that case, I think it can work very well.
Yeah. Yeah,
Yeah.
it's just so interesting. I've worked at like every 3 months I go to this retreat center in Colorado where they use psychedelic substances like psilocybin, LSD, MDMA, and ketamine in various, just very dependent on the person in this situation. And so sometimes there will be couples there that are on using MDMA specifically, and then they can really engage in this experience and this dialogue, and it's almost like accessing things that they normally couldn't access, and then also like creating something new together. Uh, yeah.
Yeah, I think so. In that case, yeah, it's a different experience and can be beautiful. And often in certain psychedelic circles, they'll use different things. They'll mix, MDMA as a heart opener, and then some psilocybin where you do more of a deep dive within yourself. So,
Mhm.
some of these things could be a little difficult. Even ketamine, as you escalate the dose, psilocybin, they can be challenging experiences if you have things to work on. It's not there to cover up or to fluff over. It's there to really go and go into the places where we need to do the work. And that can be hard sometimes at the beginning, but very rewarding and helpful. Yeah.
Yeah.
If it's properly integrated. Yeah.
Yeah. Yeah. And maybe we can get to that integration piece in a moment. And what's kind of coming up in my mind right now is I know a lot uh of men that I've worked with or listened to the show have written in or spoken to me about, just feeling these blocks to being more vulnerable, feeling these blocks to being able to open up more with their partner. And I'm wondering, just from this conversation of better understanding the specifics of the substances, how selecting what you're going to be using could be really powerful to help kind of move through that specifically.
Yeah. I mean, I think vulnerable, exactly, we only feel vulnerable because we don't feel safe, or for whatever reason during our life, these emotions are not things that we're comfortable with or comfortable, and it brings up old situations we don't know how to hurt, we don't know how to work through, we don't know how to handle. So when you do some of these psychedelics and ketamine, you move beyond it, you almost step outside of it, you see it very objectively. Sometimes you might feel the emotions, but the emotion's not really linked any longer to a past memory. So you process the emotion separate from the memory, and then you sort of separate, and then and then you just they sort of dissolve away. So things that would normally make me feel insecure in any way, you sort of work through. They no longer do that. You don't get triggered as much into that insecurity. And that's
Yeah.
what really, really helps. Is we call it a neuroplastic process. It opens up the neural these pathways. One of them you might have heard a lot in Michael Pollan's book, how to change. I'm looking at I have it on my desk. How to change your mind. I always forget the
Yeah.
name book, but it's called the default mode network that creates these sort of patterns in our brain that connects past memories with emotions. And it does so
Mm.
to sort of protect us. So, in life, if, something bad happens, that'll be associated with a memory. So the memory of that bad event will be connected to emotion. So next time I see something that even resembles that, it'll trigger an emotion to help me alter my behavior to get away from that dangerous situation. But a lot of those situations, maybe as a child, the parent said something, or might have been exposed to a divorce or a very difficult, abuse or whatever it is. And the parents are there for our survival. And if we don't feel our parents are not there and not supportive of us, we don't feel safe. And that gets programmed in the brain through these default mode network situation. And so anything we start to see the world as a very unsafe place, adults, loved ones, you know, people we even have relationships with, we see them as unsafe because if my parents didn't love me, well, how's this person going to love me? I'm not good enough.
Yeah.
And so that gets wired in. So what the ketamine does and some of these other psychedelics do is they open up, it numbs the default mode network. It decouples the memories from the emotions and allows us to create new pathways, new, you know, I guess new connections. So in the future, when we see things that would normally trigger us into a certain emotion based on a past memory, no longer do so. So it doesn't get rid of the memories, it doesn't get rid of the emotions, it just decouples them. And it gives a little bit of space, a little bit of buffer to say, okay, how do I want to see this situation? Maybe this is not so dangerous. So I don't go right into this place of fear. I can actually have time to determine how I want to see the situation or that person or my loved one in front of me, or what they said to me, rather than from a place of, it's bad, from a more open place. And then I'm more likely to respond in the way I truly want to respond to, from a place of safety, from a place of where I am today, not where I was as a child. It's like updating the operating system in a way. In our
Yeah.
operating system, we update our phone, we update our computer, we don't update this computer, and this is a computer, so we're still working with algorithms that were built in from when we were children. So
That
that's
old coding. Yeah. 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 And we've had a couple of episodes on the show about attachment styles, and it sounds like a piece of what you're describing here is really repairing some of the damage or just the wounds or the experiences that could make us anxious or avoidant or influence the way that we engage with relationships in
exactly.
general.
Yeah,
Yeah. Yeah.
exactly.
And okay, I'm thinking we talk on the show, we talk about sex a lot, and I'm wondering,
Mhm.
it, what would an experience with a psychedelic like ketamine or otherwise do to improve our sex lives?
Right. I think it brings you into more presence,
Mm,
more intimacy. Sex, I mean, we could have sex without intimacy, of course. It's not as fulfilling. I mean, people could use porn, masturbate to, porn all the time. But any man who tells you you use it for it, there's no, after you're done, there's something missing. There's like an emptiness, a hole, you know? So when you have the sex without the intimacy, it's just sort of, yeah, there's something missing. But when you're really present in a sexual experience and you mix that intimacy with emotion, with feeling, with an openness, with a vulnerability, and you
mm,
let go into that, after you're done, you're like, oh my God, you're left with this sort of bonding. It actually increases the bonding,
yeah.
increases the connection. Sex I think, is a tool that we're born with to allow to connect people, to bring love between, or to bring the intimacy again, or to bring the couple back together. That's what it's for. It's there to, okay, to procreate is one thing, but I think it's also beyond that. If it was just to procreate, well, after, our procreative years, we wouldn't even, our sex drives would just go to nothing and we wouldn't need it anymore. But we still have that, even in much later on in our later years, in the 80s, there's people having very good sex.
Hmm.
Not as often and not as, but it can be very good and very good. But hopefully there's more love, more connection. So I think that psychedelics could really bring that connection, that intimacy back into the sex, and have a better balance between the excitement and the excitement of sex with the intimacy and the tenderness of sex. And I think that's where it could really help. Yeah.
Yeah. Yeah, and it's interesting after, speaking about how this can be an experience where we're really looking at our relationship with ourselves and shifting some of the pieces of ourselves, because just taking that and then understanding, looking at things like performance anxiety or, sexual dysfunctions like PE or ED and how psychological those can be as well. Yeah, I don't know if you've ever worked with anyone who's reported changes in that after
Yeah.
going through a treatment or yeah.
Yeah, they have. And I mean, I think, like, ED, what is it? It's just not letting go. It's like we're too hyper aware, we're too focused. Same thing with, we have like a nervous system, we have a sympathetic nervous system and a parasympathetic nervous system. It's best when they're balanced. But when we're in like when we're in sympathetic, we don't feel safe. We're going to sympathetic tone, so this sort of fight or flight. And when we're in fight or flight, we're not supposed to be we shouldn't be thinking about sex. We
Yeah.
shouldn't be thinking about going to the bathroom. We shouldn't be thinking about going to sleep. All
Mhm.
those things. If you think about the biggest problems, especially with men, are they have a heart issue sleeping. They have issues with erectile issues, problems. Even young people,
Mhm.
very young. I give out, Viagra to young, people in their 20s. They have one bad experience and they become self-aware. They don't feel safe. So they're too anxious. So with,
Yeah.
psychedelics, we start to be less self-aware. We get out of ourselves, you know,
Mm.
when you get into parasympathetic tone, and that's where you just let go. You let go. We let go into sleep. We let go into sex. We let go. We allow it to happen. We let go
Mhm.
into, being able to urinate properly. People are standing at the have that pee shy. Some 5 people are around you and
Yeah,
waiting
yeah.
behind you, and like, oh my God, and I've had it. I've had that. I had that issue. I have this thing. I get into, how I get. I just start focusing on the tiles in front. I figure out some technique where I get out of my head and I let go into it. I'm just like there, and I forget about everything around me. So I
Yeah.
think, and that's where psychedelics really get us out of this self-awareness, that ego self-awareness, and just allow you to let go, let go, let go. And
Mm-hmm.
when you start to let go, then you're just there not to just please myself, also to please my partner. That also helps when my focus isn't just on me getting up, but actually, pleasing and getting my partner excited. It's so nice. You're sharing. So it comes from not just something I'm receiving, but I'm sharing. And then that just goes into a thing. And I think that, especially with another, woman, when they'll feel that, women are very intuitive. They know right away when your mind's on someone or something.
You're like, where are you?
Where are you here? But when you can let go and just be present, and then the whole circuit will just improve so much.
Yeah. And understanding well, I guess let me ask you this, because I think this might be a question that people would be wondering about is all of these shifts and these changes, is this something that only occurs when you're on the substance? Is this something that lasts? Is this something where you have to like come back to it every once in a while? How have you seen the impact of maybe going through an experience with a substance and what it does in the long term of a person's life?
Yeah, I mean, all of the above, but I think the more people do the work, so doing a psychedelic experience is not just about that. So it's not like this is going to solve all your problems. It's a catalyst. It's a tool that we use to help people open up and then to do other work. So the aftercare is just as important as the actual psychedelic experiences. So what are you going
Yeah.
to do afterwards? So that's why I'm saying like doing, you know, also sometimes it might be couples therapy if there's some issues you need to work out. So doing the psychedelic experience and going into the couples therapy with really good with an openness, a greater openness on both sides could be incredibly valuable.
Yeah.
So you're taking it out when you're doing the couples therapy, sometimes it gets too intellectual, too much, but when you let go and you start to empathize with your partner, so instead of just thinking about what's good for me, what's good for my partner, you start to, so I think it moves therapy forward very in incredible ways. So I
Mm.
think doing some therapy, so couples therapy, sex therapy could really help with the psychedelics. Spiritual work could really, meditation, breath work, all these other things can really, really help in that respect.
Yeah.
But sometimes people do need boosters of psychedelics. We forget, we're humans, and
Yeah.
sometimes this thing is very strong, and the wires are, although they might be loosened up, they're not completely let go of.
Yeah.
So sometimes we do need booster, we do need reminders from time to time, and that might be every few months or so. I think it's great to do this and to remind ourselves from periodically.
Mhm.
Yeah.
Yeah. Yeah. And maybe we can perhaps explore a little bit of some of the considerations because maybe I'm just thinking, someone listening, like a guy might be thinking, this all sounds really great, but I don't, first of all, like have access to or really want to put a substance in my body. How could they kind of tap into some of the benefits, or how could they have an experience alone or with their partner that creates some of this without perhaps, if that is even possible?
Yeah. I think, there's spiritual wisdom. There's a lot of really amazing books, spiritual wisdom that helps
Mm,
me. Actually, my psychedelic experience started with more of a spiritual guy. I started studying spiritual wisdom after a patient of mine
mm,
gave me a book, and I didn't grow up, religious or spiritual, but I got into it, and that changed. That was my real
mm,
real psychedelic experience. The soul manifesting, so it allowed me to see life and see the world in a much more open way. So people have faith or things like that
mm,
that could help a lot. Breath work, there's a holotropic breath work. So there's these breath techniques that can bring you into a quite a deep psychedelic type experience, but it should be done with a practitioner or at least taught with a practitioner. So that
mm,
could really, really help. I think sometimes just going out in nature and taking like a break, taking like if you have children at home, taking date nights, where you're just together alone, or taking a weekend, a little like a one night vacation somewhere, in the country somewhere, and just to have this time to be in nature and just really spend time together. Could be a psychedelic type experience where you just remove all the boundaries of yourself and just go into this sort of other place that can be very helpful and good for relationships and should be done regularly.
Mm.
So I think there's other ways of having a sort of what we call a psychedelic or soul manifesting experience without having to use a substance. Not everyone has to use a substance. I
Yeah.
think the substances definitely, are a quick catalyst to it,
Yeah.
but it's not for everybody. And I think taking up meditation, doing certain amazing, there's different versions of yoga that are incredible. That can, breath work, yogic breath work
Mhm.
is great to get us out of the thinking mind, the overthinking mind. So,
Yeah. Yeah, as you're explaining this in many ways, it's almost sounds like so much of this practice is about becoming almost like really present in the moment and also removed from like we just get so stuck in our heads all of the time, and that so heavily impacts how we show up in relationships, heavily impacts what we're capable of doing when it comes to intimacy and sex. Like we're just how like it's like get out of
mhm.
there.
I
And I
know.
don't mean that to like talk shit on the brain, but
No, I think we depend on it too much. I mean, the brain is there to help us, really is there for our survival to exist,
yeah,
to make sure we physically exist in this world. And it does so in a very good, but sometimes we depend on it too much.
yeah.
And we go into these thoughts and the things we worry about. If we added up all the things, if we wrote a fear journal, all the things we worry about, put it in a journal, and we think we're insane. What
Yeah.
percentage of the things we worry about and we think about actually are valid or important or ever come true? Like
Mhm,
0.00001%. But yet we spend 99.9% of our life thinking about these things that are of no value to us.
mhm,
When things
mhm.
happen and there's problems in our life, we'll deal with them. And we can never foresee exactly what's going to happen. So we're going to have to, go to our inner wisdom. We're going to have to deal with it in some way, you
Yeah,
know. So,
yeah,
um, yeah, I think we have to get out of I think, like you said, I think it's too
yeah,
much of the thinking, too much, too much, too much.
yeah, yeah. And, and I just keep I have found, I guess just in my own personal life and in witnessing changes in other people, how truly incredible medicine like this can be. And like I don't want to think that this conversation is about like really trying to push the narrative of like do this, do this. So when we look at considerations for perhaps what people should think about before making the choice to explore something like this, what
Right.
be it for themselves, for their relationship, for their sex life, what should someone think about or know, perhaps?
Yeah. I mean, you have to have an intention. Yeah. I always say these things call you when you're ready for them. So
Yeah.
I don't like when people are pushed into them or, you did, oh, I want to go do an ayahuasca journey. Like, oh, I heard it's the cool thing and my friend did it. They said you should do it. I
Yeah.
mean, it's a big deal to do those things. So, you really have to know what you're getting yourself into. And, it's not easy. Most of the people, so in our center, we only treat people with mood disorders, so treatment resistant mood disorders.
Yeah.
Uh, and I don't think those are diseases in and of themselves, not at all. I think they're most of the people here have had difficult childhoods or some issue in the child that they can't let go of, and that
Mhm.
sort of colors the way they see the world.
Yeah.
So everything's sort of negative. So they stay in their emotions all the time because they never feel safe. And so what this does is it just allows us to move beyond that. So, so usually if there's a real big problem in people's personal problem, and you're not here to fix your partner, remember, that's very important. So if you're going
Mhm.
to go into this thing, no one should ever get into a relationship thinking, okay, I'm going to fix the other person. We're not here to fix anybody but ourselves. And by fixing ourselves, of course, other people will benefit. But the biggest problem people make is, okay, I'm going to do this because my partner should do this because they're the problem. And no, you want to fix it, you fix yourself. You get into a place, and then you'll be in, So I think that's very important also that you're doing this to work on yourself.
Mhm.
And yeah, that's another thing. And to get into psychedelics, I think I don't think they're that crazy. It sounds crazy, but it can be really, really, really beautiful work. And again, it's just a journey into yourself. Yeah, I haven't seen any. I've seen over 10,000, of these infusions since we
Wow.
started. 10,000. So it's a lot, 2,000 people come through the program, more than that. And I've never seen anyone get worse generally after these things. They
Mm.
always change. Does it work on everybody? No. You have to want to change. So I guess
Yeah.
yeah, the question is, you have to really want to let go and want to change yourself.
Yeah.
Yeah, desire. And changes, there's a part of us that's perfect, not change, but become more of who we want to be. Like, so
Mhm.
who we consider, we look at in the mirror is very different than who we are, who that inner being is. There's a beautiful part of ourselves that's sort of perfect, that's wonderful. And we come as well, I think we come here to figure that out. Who are we? And sometimes, we might have done some things that we regret in life. And sometimes we get to know ourselves through those negative things. So we say, okay, I did this negative thing. If I was really that bad, it wouldn't bother me. And if this thing that I did is bad is bothering me, then it's not who I am. So maybe I make a commitment and say, okay, that's not who I am. Okay, so I'm going to make a commitment not to do that again. And we learn about ourselves and what we want, who we want to be, and how we want to act, through those situations. And I don't think there's any mistakes. I don't think anyone makes any mistakes.
Mhm.
That's something I've learned through psychedelics. I think they're life experiences to get to know that and to learn from those events. And we either learn from them. Their only mistake is if we don't learn from them, we keep on doing the same thing over and over, then maybe it's a mistake.
Yeah.
But if we learn from them and grow from them, then it's definitely not a mistake. Yeah.
Yeah. Yeah. I appreciate you sharing all of that of first the noticing if you're feeling called to do it or if it's like where the desire is coming from. Is it like an external thing of people telling you to do it, or is it something that you genuinely want to explore for yourself? And I think that's a really important piece of it as
Yeah.
well. So in thinking about if someone does go through an experience like this, and we've talked a little bit about the integration, the aftercare, if they're in a partnership, what can they do either together or do you have any advice for how a couple might be able to navigate if one or both of them are moving through an experience like this?
Yeah. I mean, together, if they're in a psychedelic, like a journey together, or
Well,
is it just going?
even just, yeah, even just if one of them is going through treatment or if they independently or together have an experience like afterwards.
Right,
Or
how to integrate it together, like
yeah.
to know that everyone's going to grow in their own way. And as you go through these things, sometimes at the beginning it's hard. It takes more than just one treatment to, like, you're not going to have one psychedelic experience and it's all going to go. It should be done sequentially. We do a series of 6 here, and I usually say you really don't get much out of it until about the third, until it's a process of letting go. But to know that everyone's going through their journey at different times in different ways. So one might progress faster than the other. So sometimes that could create some imbalance in the relationship. So to be patient with yourself,
Mhm.
know it's your journey and your experience, and not to compare it to your partner's. So
Mm.
and everyone has different issues, some in a relationship, and that's the beauty of relationships. You're not meant to have the same, you're each bringing in different things. One person has, some, are stronger in certain respects and weaker in others, and the other one, you're supposed to be different. And so you can sort of balance each other out. So
Mm.
some people might have a psychedelic experience that's the most amazing thing, and their partner had the worst experience of their life, and it was like, oh my God, and they're starting to see some really dark stuff, and they feel bad. They feel bad about themselves. Maybe this isn't working. And they still discouraged. So you don't want that to create a problem in the relationship, where one's progressing and the other one's not. It's all good.
Mhm.
And also sometimes you have to know that one people are going to progress through it in different states and different rates, and have different things to work through. And the other partner, they should be sensitive to that. And you don't have to share everything that comes up in that. You want to share with you, but just know that it's your personal process. And once you start to work on you're there to work on yourself. You're not there to tell your partner what they should or should not be doing, you know,
Mhm.
experience, or how they should be responding better. Like, look how good I'm doing, and they're, oh my God, why aren't you doing, like, no, it's their process. So you should be there for them, hold them, and not try and proselytize that you had this, because you had this great experience and you're now spiritually evolved. You're going to go and tell the person, your partner, what they should or should not be doing, or feeling.
Yeah.
Just to be there with them, and to be empathetic
Yeah.
for their process. Yeah.
Yeah.
So
Beautiful. Yeah. Yeah. And I'm thinking too in preparing for something like this also, are there any precautions or just some tips perhaps that you would even have for someone that might go through a process like this, whether it's, you know, even something simple like carving out some time afterwards or taking a day off of work or making sure like what are some things that you found to be really helpful for people to have the best experience they can?
Yeah, I think preparing before is important. I think at least a week before. Sometimes I say like there's a journey. Once you can make a commitment to do something like this, you're sort of the universe knows you're doing it. I have to say it's a little woo-woo and spiritual, but you'll start to see the week before might be a little crazy. You might be shown some things, and to fight with your kids, your wife, your spouse. Some things will happen where you'll be shown almost some of the things you need to work on in the journey. I always find that happens to me when I've done this work. To also, so focus on those things, but don't bring anything unnecessarily negative into your consciousness the week before, at least. Some people a month before, but a week before, or from when you make a commitment to do this. Watching negative things on TV, news. You want to focus on your own negative things. So when you go into those journeys, you don't want to like to start thinking about a horror movie you watched a couple of days ago,
Yeah,
or
yeah, yeah.
seeing something really negative on TV, or you know yeah, like anything. So things will come up and they'll come up naturally. And of course, and that's not by mistake. And I think that's fine. But you don't want to go looking for things. Eating healthy before, staying away from alcohol. That's a big one. So alcohol, any substance, it's best to come in clean. So if you have a habit of, if you use marijuana or alcohol or any other substance on a regular basis, of course, if you smoke or use nicotine or whatever it is, you don't expect you to stop, but maybe cut down a bit, work on it. And actually, psychedelics can be very helpful in coming off of those things. That's a whole separate thing. But not drinking or not using substances or marijuana a good 2 days before, if that's available to you. Obviously, if you have an alcohol problem, you don't want to stop suddenly and go into withdrawal. So you have to work with and work on weaning off of that. But generally, it's good to come in clean, to allow the psychedelic, whatever it is, to let it do its work, and not mix it with anything else. So,
Okay. Yeah, that's all really helpful to consider. And in thinking as we're kind of coming to a close, I'm just so curious about like really based on your experience and your research and your understanding of this field and this science of psychedelics as medicine and as a tool for healing, what do you predict is going to happen in the future? And I'm also curious of like if you have a piece of advice for someone that might be curious about exploring this path a little bit deeper to deepen their relationships, their sex life, their connections, like what that advice would be.
yeah. So I think, I mean, the future of psychedelics, I think it is the future. I think it's going to go through like everything else. There was all this excitement about it, and then it'll start to mature, and some of the, we'll get a little more realistic with it. I think it has incredible potential. I didn't expect to go into this full time, and I saw how effective it was, and so I gave up my other job and went into this full time. And I think it's beautiful, beautiful work. It's not easy work. It is work. So it's not just something you're going to come in here, get a high, and feel great afterwards. It's work. And so yeah, I think as far as the future, I think there's going to be other beautiful things coming online. Right now, ketamine is the only one that's legal. I'm not sure. I think it's incredibly powerful, and I think it can be just as good as any of the other ones. I mean, we have studies showing, it's just as effective almost as MDMA for PTSD and things like that. For addiction, I've seen incredible results. But I think there's a place for MDMA. I think there's a place for psilocybin. And in the future, we might be using these in combinations and different permutations, together based on, and certain things might work a little bit better than others for certain things. So hopefully these things will be, made available legally for clinical use. MDMA, the FDA just sort of rejected the approval of MDMA for use, but they're going to have to do more tests and more studies. I'm not sure why. I don't think the company didn't handle the approval well in a professional way. I think that's what happened. But I think eventually it will be approved. It might take some time, psilocybin, but we have ketamine. I have to tell you that I think ketamine is easier to work with. MDMA was going to be a problem anyways. The expense of it, like in Australia, it costs about 26,000 Australian dollars to do I think it's a 3 or 4 treatment regimen.
Whoa.
Yeah, so it's a lot of, because it's 8 hours. You have to have a practitioner there. You have to have, it's a lot of, it's very heavy, where ketamine is very safe. It's only an hour-long session. We've been using it since the 1960s. It's super safe. So it's easy to work with it. And the other thing with a lot of the other psychedelics, you have to come off of your psychotropic medication. So people who are on antidepressants of various sorts have to come off of them before they can go into use those other substances, where with ketamine, you do not have to come off of
Mm.
them.
Interesting.
Yeah, so that's a very big benefit to ketamine. Yeah, I think it's easy to use, and we can give it intramuscular, we can give it through the IV. There's other sort of ways that we give it. There's Spravato, which is a approved version through insurance for a nasal spray. That's not really a psychedelic, but it works, has pretty good effects for mood disorders. But for as far as like relationships and people with, sexual dysfunction in the relationship, I think, I think therapy really helps, but I think the psychedelics can be incredibly helpful. Again, I think it all comes down to some personal issues, our own fears, our own insecurities that really we bring into the relationship, and often bring onto our partners and make our partners feel insecure because we can't deal with it. So I think once we start to really work on ourselves, I think the whole relationship could turn around. And so that's why I'm so focused on like our work and bringing that in. So I think it can have amazing effects. And I think eventually with like psychedelic, we've actually had a bunch of, sex therapy, sex therapists come to our center here and do journeys among themselves to help use ketamine in sessions with their clients. And I think there's been some amazing response with that. So I
Yeah.
think amazing, amazing potential. I think it's beautiful work. I can't, I can't, I really do recommend it for those who are open to doing this work. It can be a really beautiful way to open up, to help heal a relationship. Or even if it's not broken, to take it to the next level. It's hard when you're in a long relationship. How do we keep that spark going? How do we keep that intimacy going? You know, and I think that can really, really help us. Also, I think there's also a lot of issues with porn addiction. I think it helps. That can really have an effect on a relationship. I think overuse of porn is a relatively new, it's always been there, but not to the extent that the availability of it. I don't think it's always healthy for a relationship. So I talk to my clients about people come to me here for that specific purpose. So it does help get away from the need for that, like that sort of escape. People use it as an escape for when they're stressed or they're depressed, like they would marijuana or anything else. So when we start to pull away from that, not use that as much, we can focus our sexual energy towards our partner. So I think that that pornography could be very detrimental when used alone, for our own use to a relationship. It just takes away our hunger, and does
Yeah.
things. So
Yeah, many months ago we had a guest on that was specifically worked with individuals that were suffering from porn usage that they were not happy about. And it was really interesting to talk with him about what is actually happening to your brain when
yeah,
you are consuming pornography. And so it's really interesting to think about what a psychedelic substance could do, just in understanding the changes that happen with the neuroplasticity in the brain under these substances that might change that kind of brain chemistry.
there's some
It's
great TED Talks on this. Like I literally watched a TED Talk, and it's fascinating what it does to a brain. It's
yeah,
quite dramatic, and it takes
yeah,
a long time to get it so it could help with that sort of reprogramming of the brain, because it's not normal. We've been, it's been available now. You have a whole generation of people who've grown up with it from a very young age. And I'm not making people feel guilty for using it. It's not a matter of good or bad, not at all. It's not a judgment thing or a moral thing.
yeah.
It's just does it serve you? And is it making us happier? Like, do we feel good afterwards? Do we feel better afterwards, or do we feel worse? And if we feel worse, I say the same thing about, smoking marijuana or drinking excessively or any type of drug use. Is it serving you? And I think after, we do ketamine, people do these psychedelic experiences, they like realize they stop drinking, even if it wasn't their intention. Like they don't feel good. They're able to bring themselves to that feeling afterwards. Like, it's like, this is taking me away from who I really want to be. I'm feeling good right now. Why do I need to do this? So it's not, you don't stop doing it because it's good or bad. There's no shame in it. You shouldn't feel shame. It just, in the end, you have to ask yourself, does it really serve you, and does it serve the relationship? So, yeah.
Amazing. Well, and in thinking about someone, let's say that might be wanting to change their relationship with porn or improve their sex life or get over some of this performance anxiety or be able to be more open and connected with their partner, and this is something that they're interested in, like where can they find you? Where could they find a clinic if they're not in your area? Like how what would be the next step?
Yeah, so I mean, we're you know my clinic's called Nushama, NUSHAMA.com. It's a center in the middle of Manhattan. It's a pretty one. I think one of the largest centers probably in the world or country. We have like we've seen a number of patients, but we do it the proper. We do it with integration. So our program involves, it's all ketamine, IV ketamine, some intramuscular, and we also use Spravato for certain mood disorders. And it's a series of 6 infusions over a 3-week period. It's all done, everyone comes in, they have a medical assessment and a psychiatric assessment before, and if they're cleared, they come in. They meet with a nurse, an integration coach who helps prepare them for the journey. Then we go and we help them. The practitioners there, I'm there to help them dose and to also to prepare them for it and make sure that they feel like safe going into it. And then we give, then they give an eye mask, earphones, and then they go on the journey. It's about a 60-minute experience, and then another half hour to come out of it. And we do that 6 times, and it's really beautiful. And finding a center, there are many centers around the country doing this work. It's important to find one that does. I think it's important to have that integration. So there's different people who do it. Some people have a very medicinal view of this. It's just some chemical I'm putting in a drug, and there's no preparation, there's no support afterwards. And let me tell you something, it's a very psychedelic experience. So it's important. Some of them can be very difficult, they can be very unusual. And so it's important to have support and someone who's comfortable supporting you in those experiences. And then, because if it's not supported well, a very difficult experience can either be it could be like really helpful, and if integrated properly, and be the most clinically beneficial, or it can set you back, like someone having a bad trip on LSD and with a bunch of friends who are freaking out. It can be very scary, and you'll be left with that fear. So it's very important how it's integrated after. The same experience could be really turned into something that can really help you, or it can be detrimental. So I think finding centers that do the work properly in your area, you can interview them and ask them if they do integration. They have integration coaches before and after. I think that's important. And then, as far as the underground, there's a lot of people doing these things underground. I can't refer people, it's not legal. So I don't recommend it at all, because there's no medicinal, there's no, support. So I don't know what you're getting. There are some amazing practitioners, amazing work being done in the underground. Absolutely. It's open, we don't know. And so you have to make sure everything is safe and you feel safe. If you don't feel safe on these agents, it can be very scary experiences. So be careful with where you go.
Yeah. Incredible. Amazing. Well, we'll put for anyone in the New York area that wants to travel to New York for a few weeks. I love that city so much.
Yes.
We'll make sure that they can connect with you there. And I'm so appreciative of you coming on and sharing. We haven't talked about psychedelics and the benefits and just the experience of them on this show yet. So I'm really grateful that we were able to have you here today. Thank you.
My pleasure. Thank you. Thank you very much for having me.
Thank you so much for tuning in to this episode of The Naked Connection. Be sure to subscribe so you don't miss another episode. Trust me on this, your sex life and that special someone in your life will thank you for it. And if you really love the show, please take a moment and leave a 5-star review or a written review and let me know what you think. It would mean so much to me and this show. Until next time, happy connecting.